Good evening, fellow legislators. My name is Erica Ross, and I represent a public health advocacy group that promotes a school-based program for teen mothers that would deter them from dropping out of school. An individual's vulnerability to negative health outcome increases as the level of risk exposure increases. Vulnerable populations are those groups of people who are exposed to many risk factors, such as inadequate access to fruits and vegetables, alcohol use, tobacco use, and inadequate housing. WHO defines risk factors as any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or injury. Some examples of the more important factors are underweight, unsafe sex, high blood pressure, tobacco and alcohol consumption, unsafe water, and sanitation hygiene. Two key factors that affect vulnerable mothers and children is age and income, because teen mothers are less likely to graduate high school and less likely to earn a good living. 99% of teenage mothers are living below the poverty level and thus are less likely to receive prenatal care. Social, political, and economic factors are vulnerable mothers and children intersect. However, three resource factors are associated with later economic well-being, and they are high parental education when the parent is educated, small parental family size when the family is not a huge family, and welfare experience as a child. Factors that affect vulnerable mothers and children varies. These factors are age, culture or ethnic, and income. Two key factors are age and income. 80% of teenage women who are 18 years or older or younger become pregnant at least once. Teen pregnancy impacts the education level of mothers. A study shows that teen mothers are less likely to graduate high school, and daughters of teen mothers are 66% more likely to become teen mothers themselves. Also, teen pregnancy has an impact on babies being born with low birth weight and even the infant mortality rate. Infants born to young mothers have higher mortality rates. And when we're talking about public health, we're talking about preventing disease, prolonging life, and promoting the health of the population. And when the mothers don't get the prenatal care, the children have low birth weight. They tend to have a high infant mortality rate as well. Infants born to younger mothers do have high mortality rates because maternal age impacts the health of the baby. Mothers who have preterm labor can have implications in their health and also to their baby's health. Income is a factor that also affects vulnerable mothers and children. 99% of teenage mothers are living below the poverty level. Teenagers who also have a low income are less likely to get prenatal care. Lack of prenatal care can cause many premature deaths, health problems for children, and even death at birth for mothers and/or infants. Also, concerning the impact of income, living in disadvantaged economic areas have decreased access to healthy foods that should be consumed during pregnancy. Women in disadvantaged areas also have greater risk of exposure to crime and other environmental and psychosocial stressors, which can have a negative impact on women and their unborn child. In addition to age and income, social, political, and economic factors can impact the vulnerability of mothers and children. Socially, mothers who have first birth while in high school encounter greater odds against completing schooling than those who delay having children for several years. Because of the time and energy that raising children require, which may interfere with the time and energy required to study and attend classes. Teenagers who bear a child during the school year often leave before they can complete their schooling. They tend to drop out of school in order to take care of their kids or either to get a job. Vulnerable mothers have an educational deficit in comparison to those who bear children. An early first birth is associated with lower earnings, income, and occupational and socioeconomic status. However, some social factors can affect future life changes. Supportive family and friends are more likely to encourage a healthy pregnancy and positive attitude than a weak, unsupportive group. Also, enrollment in special school programs for teen mothers may also affect school completion. Politically, gender is tied to social status about the same way that race is. African Americans are given the right to vote by the 15th Amendment in 1870, whereas women did not receive that right until the passing of the 19th Amendment in 1920. The fact alone shows that gender and politics are strongly intertwined. Also, the U.S. Department of Housing and Urban Development works with local housing agencies to provide public housing for low-income individuals and families. HUD estimates that there are around 1.2 million families and individuals living alone that rely on public housing. Up until the mid-1970s, young pregnant women were often not permitted to remain in school. Title IX of the Education Amendment of 1972, which is implemented in 1975, prohibits discrimination because of pregnancy or parenting status in publicly supported educational programs. Schools make a variety of arrangements for schooling of pregnant students, keeping them in regular classes to provide separate programs. In addition, the serious health and social complications of adolescent pregnancy call for the examination of the laws that affect adolescents' access to contraception and even abortion. And many states mandate sex education in schools, and vulnerable mothers and children utilize state-funded family planning services. I would like to express that social, political, and economic factors for vulnerable mothers and children do intersect. An individual's human capital is measured by level of completed education, unemployment, and position, and even living conditions. These factors are tied together because a person's ability to maintain a high-paying job increases relative to how much she invests in her education, or how much we would invest in their education. As leaders, we need to invest in their education. For example, consider the fact that a child's ability to learn during the school day is directly tied to both the condition of the school and the education offered, which are both tied to society's investment in the school by way of governmental funding. For both children and adults, public and private investments in the living conditions of neighborhoods and housing units deeply affect all aspects of life, from the ability to focus during the school day to the ability to maintain viable employment. Economic conditions directly affect human capital and vice versa. Human capital is directly linked to the timing and quality of prenatal care, the ability of the mother to recuperate after birth, and the ability of the mother to care for the infant. Low-income regions have a lower rate of early and sufficient prenatal care than wealthier mothers. Level of schooling and even family size affect family income and poverty status by a mother by affecting whether or not she is employed and how much she earns. Also, for each year a young woman delays her first birth, her chances of becoming being in a family below the poverty level decreases. An early and premarital birth creates a family form in a high probability of needing public assistance. My proposed program for my community is a school-based program, state policy for teen mothers that would deter teen mothers from dropping out of school. This policy that will be implemented would incorporate a school social worker to be part of the public school system. The environment and services offers include a small school setting dedicated to serving teen mothers, collaborated with outside community organizations, on-site health care, child care services, on-site individual counseling and mentoring, on and off-site group therapy sessions, academic support services and career preparation, and also individual case management services. While teen birth rates have steadily declined over the past several years, 1 in 10 new mother is a teenager, and teen pregnancy rates in the United States is still 9 times higher than most other countries. The healthcare needs of this group is prenatal care, Head Start, and early programming for children like pre-K, programs that cover early childhood services. Effective treatment approaches would be prenatal care as education and healthy lifestyle choices. It is generally provided in an outpatient basis focused on parenting skills, social support, ongoing medical care, and case management to help them assess the sources available to them. I would also implement providing home visits that provide social support, encouragement, and resources for high-risk mothers and new babies in the home. The initial cost of the policy would cost $10 million for our pilot locations across the state, which would come from monies that are already used in the state lottery. The benefits of the program are immeasurable for mothers, babies, and the community. This policy would attract all political parties because it benefits financially, ethically, morally, community-wise, even our future generations are a good reason for all political parties to vote for this program. If I had to express one message about this policy, it would be that this school-based program for teen mothers to deter them from dropping out of school is basically already self-sufficient. We are using the staff and the facilities that we already have in place. Because it is associated with public schools, the funds are already allocated. And most important is giving teen mothers an opportunity to finish high school, which increases better support for all their families. All these points is what local legislators would need to communicate about the policy to curious constituents. Again, 2 key factors that affect this population is age and income. Mothers 10 to 14 years of age have the highest prevalence of low birth weight infants, and high mortality rates decline with each level of education gained. More vulnerable mothers have an educational defect in comparison to those who bear children later. However, I beseech you that family support and enrollment in this school-based program has been shown to be important to whether a teenage mother remains in school. I ask that you consider voting for this school-based program to help teenage mothers stay in school. Thank you.